The fight over limits on abortion is spreading to some unexpected places, including drugstores. At least one medication commonly prescribed for arthritis, lupus, and even cancer is becoming harder to get after the Supreme Court allows states to restrict or outlaw abortions. Janet Shamlian has a story of patients who are caught in the middle and dreading the possible impact on their health.
Nora Wise has been living with a rare autoimmune disease that causes inflammation in her bones. For a while, her mom says, there was no relief.
We're doing therapies and everything we could, but her pain kept increasing, and she would be crying all night long.
The 10-year-old Indiana girl says the worst pain was in her lungs.
It felt like I didn't want to breathe. It just felt like needles.
But life changed, her mom says, after Nora's doctor prescribed methotrexate.
We started the methotrexate. It took about 2 weeks, and she said she wasn't in pain anymore.
Methotrexate slows the body's immune system and reduces inflammation. It's commonly used to treat rheumatoid arthritis and some cancers, but can also be used to terminate nonviable ectopic pregnancies, where a fertilized egg grows outside the womb. Since the Supreme Court decision that overturned Roe v. Wade, some women report trouble getting the medication by pharmacists concerned they could be held responsible for aiding an abortion.
As soon as I started hearing about women in other states having this issue, I started asking the question, is this going to be a problem?
Annie England Nobland is a long-term user of methotrexate for rheumatoid arthritis, but says a pharmacy recently put her refill on hold.
They needed to make sure that my rheumatologist actually prescribed me methotrexate for my RA, and not so that I could, abort a fetus.
Nobland lives in Missouri, a state banning almost all abortions.
When you heard that, what did you think?
It was immediate anger. I was embarrassed because I was in a pharmacy line. And I said, okay, do you also need to know the first date of my last period as well?
John Dokoupil is an OB/GYN doctor practicing in Texas, another state where most abortions are illegal.
This is a common thing we deal with.
He's prescribed methotrexate about 10 times over the last year to end nonviable pregnancies and is concerned about potential delays in patients getting it.
Are there other medications that can do what this drug does?
Unfortunately, for treatment of ectopic pregnancy, no. So if this is delayed, there's a timeline that this works. If the pregnancy gets too far along, the only thing left is surgery.
For Nora Wise, the medication is a game changer. She wants to keep taking.
I know the medicine works. I don't have any more pain. It's just I hope that I'll have my medicine.
For CBS Mornings, Janet Shamlian, Austin, Texas.